Yeah, hello. Yeah, this video is about how to interpret tuning fork tests. Okay, tuning fork tests. Now, before understanding how to interpret tuning fork tests, let's see how we are able to hear the sound. Now, we will see the normal pathway how we can hear the sound. Now, from pinna, it goes to external auditory canal. From external auditory canal, sound waves are transmitted to tympanic membrane and then to the ossicular chain. Ossicular chain is, I'm writing in short form, MIS. The malleus, incus and stapes. And on the stapes, we have foot plate of stapes. And from foot plate of stapes to organ of corti in the inner ear. From there goes to the auditory pathway, to the auditory cortex. Okay? Now, yeah. Until foot plate of stapes, yeah, this is external plus middle ear. Until tympanic membrane, it's the external ear, and from ossicular chain, it's a middle ear. Everyone knows that. So, these both are of conductive pathway. So, whenever there is defect in this external and middle ear pathway, it is a conductive pathway, then it leads to conductive hearing loss. Conductive hearing loss. Okay, and this organ of corti is in inner ear. This is a sensory pathway. So obviously whenever there is problem in sensory pathway, defect leads to sensory hearing loss. And this auditory pathway and auditory cortex is a neural pathway. So if there is defect in this, leads to neural hearing loss. This both sensory pathway and neural pathway combinedly called as sensory neural hearing loss. Okay? Yes. Now, everyone knows that most common frequency used for tuning fork is 512 Hertz because it is better heard. Now, let's see. Now, air conduction and bone conduction. Now, to test the air conduction, everyone knows that we keep the tuning fork just near to the ear. This is the air conduction one. Yeah, this is the air conduction. For testing the air conduction, we keep the tuning fork near the ear, and for bone conduction, we keep on the mastoid. Okay. Now, when you test the air conduction, you measure conductive, that is from pinna to the external auditory canal, tympanic membrane, and ossicles, and also the auditory pathway also. But when you test the bone conduction, when you test the bone conduction, this conductive pathway is not tested because you are testing from here. So you will not be testing this outer ear and middle ear one, which is of external auditory canal, tympanic membrane, that that is excluded. So for the bone conduction part, you only test the sensory and the sensory one and the neural one. Okay, so we'll write this one. Yeah, for air conduction you measure conductive pathway, sensory pathway and neural pathway. All three pathways are measured. And for the bone conduction part, you only measure sensory plus neural pathway. This one is not done while doing bone conduction. Okay. Now now tell me which is better heard. Air conduction is always better than bone conduction because amplified sound reaches sensory neural pathway. This amplification is done by middle ear. So that's why air conduction is always better than bone conduction normally. Okay, now coming back to the tests. This is the main part of this video. Now everyone knows about Rinne's and Weber's. First we will see about Rinne's test, then we will look into the Weber's test. Okay, now Rinne's test. Now Rinne's test can be positive or negative, isn't it? If the air conduction is greater than bone conduction, it is Rinne's positive. This is Rinne's positive. If the bone conduction is greater than air conduction, it is Rinne's negative. Okay? Yeah. Now, I said air conduction is always better than bone conduction because amplified sound reaches the sensory neural pathway. So here given is air conduction is greater than bone conduction. So it is called Rinne's positive and it can be seen in two conditions. One is normal ear and other can be sensory neural hearing loss. Whereas if the bone conduction is greater than air conduction, it can be conductive hearing loss or it can be severe sensory neural hearing loss. This sudden severe sensory neural hearing loss can be due to viral infection or any idiopathic cause, and this can be reversible with steroid administration. Okay. Now Rinne's test can be positive or can be negative. Positive means it can be normal ear or the patient has sensory neural hearing loss. If the Rinne's is negative means it is bone conduction which is greater than air conduction. It can be because of conductive hearing loss or severe sensory neural hearing loss. Okay. Now to differentiate between, now to differentiate between conductive hearing loss and sensory neural hearing loss, we do Weber's test. Weber's test. For Weber's test, we know that tuning fork is placed on the forehead, vertex or on upper teeth. This is done to differentiate between between conductive and severe sensory neural hearing loss. Okay, now how to interpret this Weber's test is you assess the lateralization of sound. To make it simple, I will just say mnemonic so that it becomes easier to interpret for you. Okay? Yeah, the mnemonic is SOCS, SOCS. S is here is sensory one. This is conductive. Sensory is opposite. Conductive hearing loss is on same side. Okay, it means when you done Weber's test, in sensory neural hearing loss and in conductive hearing loss, we know that Weber's is done to differentiate between sensory neural hearing loss and conductive hearing loss. Now the mnemonic is SOCS. Sensory is opposite and conductive is on same side. So tell me about this. Said for sensory it is lateralized to the opposite side. For conductive it will be on the same side. Same side means the defective ear. For example, if you have right ear problem, then the defect is on the right ear. That means the sound lateralizes to the same side, that is to the right ear. Okay. Now that's all about Rinnes and Weber. Okay. Now I will see with an example how to interpret. Before interpreting, let's revise quickly. Rinnes test can be positive or it can be negative. If it is positive means air conduction is greater than bone conduction. So if it is positive means it can be because of normal ear or it can be because of sensory neural hearing loss. If it is Rinnes negative, it can be because of conductive hearing loss. It can be severe sensory neural hearing loss. This severe sensory neural hearing loss can be because of viral infection or idiopathic, and it is reversible with steroids. Now, to differentiate between whether it is conductive or sensory neural hearing loss, we do Weber's test. And to interpret Weber's test, it is you assess the lateralization of sound. First of all, you vibrate tuning fork and you can keep it tuning fork on forehead or vertex or on the upper teeth. Then you ask the patient on which side the patient hurts better. Okay. And to interpret the Weber's test, the mnemonic is SOCS, SOCS. Sensory opposite, conductive same side. Means if the patient has sensory neural hearing loss, sound will be lateralized to opposite side. If the patient has conductive hearing loss, sound will be heard better on same side. Now let's see some examples so that you will remember forever. Now, first example, patient came with decreased hearing on right ear, and when you done the Rinnes test, Rinnes on right ear is negative. Okay, and Weber was towards left. Okay, now whenever you see any question like this, patient coming with decreased hearing on any side, here example on the right side, and when you see the results of Rinnes and Weber's, first thing to do is first write it down. Rin is positive, negative. Positive is seen can be in normal or sensory hearing loss. Negative is seen in conductive hearing loss or severe sensory neural hearing loss. Okay. And Weber given was towards left. Just remember the mnemonic SOCS. Sensory opposite, conductive same side. Okay. Now in the question given was Rennes is negative. So it can be either conductive hearing loss or severe sensory neural hearing loss. Okay, to differentiate we do Weber's test. Now what they given in Weber's test, it is towards, sound is lateralized towards left side. Now see, I said sensory is opposite and conductive is on same side. The given is left. Same side means left conductive hearing loss. 2 DDX can be possible with this Weber test given in the question. Okay, Weber given was towards left. So on conductive should be on the same side. So it is left conductive hearing loss, or it can be right sensory hearing loss. Okay. Now yeah, left conductive hearing loss or right sensory hearing loss. Patient is coming with problem in right ear. So the answer will be right sensory hearing loss. Okay, in the question given was decreased hearing on right ear. So here it will be right sensory hearing loss. Okay. Let's see another example. Yeah. Patient came with decreased hearing on right ear and Rennes is negative and Weber is given is towards right side. So let's see, Rennes negative means it can be because what are the two possibilities? See here, Rennes negative, so it can be conductive hearing loss or sensory neural hearing loss. Weber is towards right. Weber is towards right means mnemonic is SOCS. Right conductive is same side. So right conductive hearing loss or left sensory neural hearing loss. Patient has problem in right ear here given. So what could be the answer here? Patient has problem in right ear. So the answer is right conductive hearing loss. Okay. That's how you should interpret the tuning fork test. Okay. Now let's see another example. Patient has decreased hearing on right ear and Rennes given was positive. Rennes given was positive. So what could be the answer for this? If it is positive means first step you write Rennes positive means it can be normal or sensory neural hearing loss. And Weber was towards left. Yeah. If it is towards left means left same side, so left side conductive hearing loss or right side sensory neural hearing loss. Here patient has problem in right ear, so the answer is right sensory neural hearing loss. Okay. See, for example, if the patient has Rennes positive, it can be normal or sensory neural hearing loss. If it is normal, then Weber should have been heard same in both ears. because normally if it is normal patient, then you will hear same in both ears. Here Weber given was towards left side. So after ruling out the option, the answer will be right sensory neural hearing loss. Now let's go to the difficult one. Now patient comes with decreased hearing, but in the question they didn't mention which ear has problem. Okay, and the test results were like Rennie's on right side, and Rennie's right side is negative, and Rennie's left side will be left side given was positive, means positive. Rennie's on right ear was negative and left ear was positive. So if it is positive, Rennie's positive means it can be normal ear or sensory neural hearing loss. If it is Rennie's negative means it can be conductive hearing loss or sensory neural hearing loss. And the options given were 40 decibel conductive hearing loss in left ear, bilateral 40 decibel conductive hearing loss, left sensory neural hearing loss, and right is normal. Fourth option is right severe sensory neural hearing loss, and left given was normal. Now see, in the question they didn't mention which ear is a problem, and they have mentioned only the Rennie's. Now see, Rennie's on the right ear is negative given, and Rennie's on the left was positive, means normal or sensory neural hearing loss. First option is 40 decibel conductive hearing loss in left ear. See, left ear we don't even have conductive hearing loss, so this option is ruled out. And second option, bilateral 40 decibel conductive hearing loss. He's saying bilateral, so both ears, right and left ear. We have only conductive hearing loss option only on the right ear, so this option also ruled out. Third option, see, left sensory neural hearing loss, this is there, and right is normal. Do we have right normal? No, so this is also not the option. Now fourth one, right sensory neural hearing loss, and left is normal. So this is the answer. Okay, that's how you should rule it out. Now fifth one, the last one. Now they just gave the patient tuning fork test results. On the right side, Rennie's is positive. Left also Rennie's was positive. If it is positive means it can be normal or sensory neural hearing loss. Positive means normal or sensory neural hearing loss. And Weber given was towards left side. Okay. Now Weber, you know the mnemonic SOCS, towards left side, same side, conductive. So left conductive hearing loss, sensory is opposite. So this one is right sensory neural hearing loss. Okay. Sorry. Now rule out what is the answer? Tell me. The given was right Rennie's is positive and left Rennie's also positive, and Weber is towards left side. So with the Weber towards left side, what all can be possible? Left conductive hearing loss or right sensory neural hearing loss. See, right, no, first we'll see left conductive hearing loss. Do we have conductive hearing loss on the left side? No, so this is not the answer. Do we have right sensory neural hearing loss on the right ear and sensory neural hearing loss? So this is the answer. So the answer is right sensory neural hearing loss. Okay, just remember this, then it will be easier for you. Release, whenever you see any question, just release. First you see release. If it is positive, it can be normal ear or it can be sensory neural hearing loss. If it is negative, it can be conductive hearing loss or severe sensory neural hearing loss. To differentiate whether it is conductive or sensory neural hearing loss, we do Weber's test, and that is done to assess the lateralization. Interpretation is by assessing the lateralization of sound. Just remember the mnemonic. For the sensory side, the sound will be heard on the opposite ear. For the conductive hearing loss, sound will be heard on the same side. Okay. For the sensory part, sound will be on the opposite side, and for the conductive part, it will be on the same side. Then it becomes easier for you. Okay. That's how you should interpret tuning.